timely bunch on a hot, humid day. Thank you for joining. We're going to get started even a minute early, and some of our colleagues, I'm sure, will be joining in. So please welcome them quietly as they come in, and continue throughout the morning to nosh and have coffee. And after we're done with our program this morning, please, if you have time, spend it with each other, schmoozing and networking. So there's some of my Yiddish for you. I'm Adam Rabinovitch, the proud executive director here at Westchester Children's Association. I'm going to welcome you all and tell you a little bit about this morning's program and share some gratitude. And then we're honored to have County Executive Jenkins here to share some reflections and remarks, and then we'll have a great conversation, both sharing out some data highlights and then talking with an incredible and diverse group of accomplished and seasoned panelists from Westchester County government across lots of domains. So thank you all again for being here, making time on a Thursday morning. This is our 4th annual Commissioners Conversation, and your feedback will be more than welcome afterwards as we continue to lean into this strong partnership with our friends at Westchester County government. I just want to state for clarity what our mission is. It's a lot of words, but it also means a lot. At WCA, Westchester Children's Association, in our 112th year, and I was just given by one of our former board members a foundational block that goes back to our 100th year. We're dedicated to improving the lives of Westchester's young people by shaping policies and programs to meet their needs and by keeping their well-being at the top of the public agenda. And this room represents that shared partnership. And I know we also all assume and know that we all share a vision, which is that every child is healthy, safe, and prepared for life's challenges, regardless of race or zip code. So that's a little bit of why we're here. I want to thank some folks who have made sure that we can be here. And I'll start with some of our sponsors and donors, including and represented here WMC Health. Also thanks to Hudson Valley Credit Union. Big thanks to all of our donors and supporters who make sure that we sustain the work that we do. I also want to thank our partners here at the Greenburgh Library and Jennifer, who's been a great partner in our 4th year here together. Also, thank you to our board of directors. We just elected some new board members, but I wanted to recognize that Adam Momoto, our board chair, is here. Some former board members. If I'm missing anyone, that's on me. So thank you for your fearless leadership as well. I'll be thanking our staff in just a little bit. And I want to recognize and thank for joining us today, Assembly Member Dana Levenberg. Thank you so much for being here. And Morgan from Governor Hochul's office, thank you very much. If I'm missing anyone else in the room, some of our elected officials or others, that's on me, so don't hold it against anyone else. Thank you all for being here. And on that note, big thanks to a true fearless leader and visionary, our County Executive, Ken Jenkins. Please join us for some reflections and remarks.
All right, so first, good morning, everybody.
Good morning.
Go New York, go New York, go. So first, I think that no one got any sleep last night, so I know we have a late arriving crowd today, but certainly, Adam, thank you and the Westchester Children's Association for convening this very important meeting and gathering of leaders, advocates, service providers, public officials, Knicks fans, and improving the lives of children everywhere. We want to thank the WCA team for its continued leadership and creating opportunities like this, for bringing folks together to talk about issues that surround most and matter to our issues that matter most to our residents and to our children. First, I'm really proud of our team that is here. Our Director of Operations, Emily Salzman, is here. Thank you for taking pictures. Emily is like, it's all good, right? And all of the members of the team that are here, and I'm gonna say them all, but I'm not gonna stop and say all their titles because that'll take like forever to do, but I wanna make sure that we recognize, wait for the applause for all of them to get recognized. Blanca, Lopez, and Michael Orth, our commissioners that are there, Befus, John Befus, Elizabeth Oliveto, Rachel Kotzur, Renee, Recchia, Susan Weissman, and those panelists that are sitting up here. I didn't miss anybody, did I? Okay, good. Give them a round of applause for being here, for all their work. Their professionalism every day makes the difference in how we work together to make sure that we're moving Westchester forward. You're working with Governor Hochul, working with all of our state legislators, our assembly members, our state senators, all of you as colleagues, trying to navigate through all of these challenging and difficult times to try to make sure that we're making a difference for people every day. I think we have 3/4 of the leadership team from DSS here, so we'll figure out who's really running the show today. Their expertise, dedication, and commitment to public service help make sure that Westchester County continues to provide high-quality programs and resources that strengthen families and support children at every stage of life. But we know, we're talking, preaching to the choir in this room, that the challenges facing children and families today cannot be addressed by any one single agency alone or any organization alone. Whether we're talking about health, mental health services, early childhood development, education, housing stability, youth engagement, or family support, progress requires collaboration across government levels, nonprofit organizations, schools, and community partners. Events like today's event are valuable, not because it just gives us a chance to have fun in the Greenburgh Library and eat noshes, but it has the cross connections and allows us to build those cross connections that allow us to do the work that makes a difference for everyone in every family in Westchester County. Our administration remains committed to investing in programs that help children thrive and families succeed. We understand that supporting children is not only the right thing to do, it's an investment in the future of our communities and our county. Every child deserves the opportunity to grow up in a healthy and safe environment, supported, and understanding the value that all of us have together to reach their full potential. I'm looking forward for all of us having this conversation and hearing the feedback about what makes a difference and how we can help those children reach their full potential. Thank you again to our Westchester Children's Association, our panelists, and everyone here for the work you do every day on behalf of Westchester children and families. Together, we're going to continue to be able to move forward to build a stronger, healthier, and more equitable future for the next generation. Don't ask me about the watch party on Saturday at the County Center, because we don't think we're going to have one, because it's Comic-Con, I'm sorry, and for those 3,200 people that were there last night, thank you. But more importantly, again, we gotta continue to do this work. No matter what happens at the federal level, the partnerships that we have, we got our political times that are coming up. That starts on Saturday. Make sure you vote early and vote often. That's what we do in Yonkers, right? Thank you for the joke. But that's what makes a difference. And your work and the leadership of the Westchester Children's Association. Adam, thank you for everything you and the team continue to do and be able to move forward. Have a great day, everyone.
Thank you so much, Nixon 5. Thank you. We'll see you at a World Cup watching party after we get through the fifth game. Thank you, County Executive Jenkins. Your remarks are always heartfelt, authentic, and spot on, so appreciate you taking the time to be here and share some reflections. Just a couple of other shout outs and gratitude. I mentioned our board, and Carrie King is here, our board president, so thank you, Carrie, for joining. Luke from Governor Hochul's office, I think I just saw come in, so thank you all for being here as well. We're going to move into the next part of our program. And before I do that, I just want to shout out teamwork. It's not only about the Knicks, although it's mostly about the Knicks, but as part of the team, and County Executive Jenkins mentioned Emily Saltzman, so thank you for being a wonderful partner and helping to coordinate this morning. And I know we've done this together before for at least 4 years. And to the Westchester Children's Association team, who really helped to put together this morning's thoughtful program and presentation, and again, a great group of panelists who you'll hear more from in just a few minutes. I want to thank Nora, who's our Director of External Affairs, for a lot of the behind the scenes and in front of the scenes work. And a big shout out and thanks to Lynn Cabrera, the Director of our Data Operations and Finance, who you're going to hear from with Brandon Washington. Thank you, Lynn. Who brings behind this program for years, and she passed the baton to me after moderating last year, so thanks for that. And without further ado, here's Lim and Brandon to share some data bulletin highlights with you all.
All right, here we go. Okay, good morning, everyone. Morning. Come on, the next. All right. So thank you so much for being here and for continuing to show up for children and families across Westchester. Oh, late night. Anyway, WCA has long strived to provide actionable data for children's advocates across Westchester. And our data bulletin, first published in 2014, has always been on the forefront of those efforts. So today, I'm proud to announce the planned release of the Westchester Children's Association 2026 Data Bulletin. You are actually seeing sneak peeks of it right there. And we're putting final touches on it. One of those posters, you see that pink Post-it, I couldn't help but do a little update like right there on the spot after this morning, and you'll find out more about that pink Post-it pretty soon. And we're aiming to get it done for June 18th. So I would be remiss if I didn't give a special shout out to the efforts of Brandon Washington, our new data analyst and storyteller. Yay, okay, and he'll be up in a couple minutes and he'll be saying stuff. And unfortunately, one of our, another member of our team, Gabriella Fidelio, who started out as an intern last year and then became our de facto economic analyst, she couldn't be here today. And so I'm giving a special shout out to them because although I've had, the support of the WCA team throughout the years, the amazing WCA team staff, I have to say that these two additions have allowed us to find more data sources, to dig deeper into the material, and to ask more meaningful questions about the well-being of Westchester children and families today. So, if you looked at our data bulletin across the years, you could argue that we've always aimed to be just a little different and hopefully a little better with each publication, as we've refused a cookie cutter approach. And after hearing directly from our nonprofit partners, we made the decision to actually put the data bulletin fully online. Not only does it save trees, but it more importantly gives us the flexibility we need to respond to a world that is changing in real time. Because we are not working under static conditions. We are working in an environment where the data evolves quickly and our tools need to evolve with it. Okay, I'm gonna see. Okay, oops, okay. Obviously, I should have put some more notes here. But this shift also allows us to go deeper. So instead of squeezing interpretation into limited space, we now have the ability to include more commentary along with our charts. And it doesn't mean that we're just presenting data. We're also trying to make sense of it. We've always tried it all along, but now we have more room to do that. And in a way that doesn't overwhelm, but instead adds clarity. So we also rethought about how we're going to deliver the data bulletin. So rather than releasing everything at once, we're going to be releasing it in chapters throughout the year. Chapter 1, which will be available next week, focuses on demographic and economic data, and boy, are we going to be talking about economic data today. Chapter 2 will be focusing on early childhood and childcare and will be released in early fall. Chapter 3 will be focused on school-age children, and Chapter 4 will focus on teens and young adults. And we aim to get this all done before the end of this year. So this approach allows us to bring forward information when it's most relevant. So advocates, policymakers, and community leaders can use it in real time to inform decisions. Now, I want to spend a moment on one theme that cuts across everything in this year's bulletin, and that is, my cost of living. My cost of living poster, it somehow dropped out, but that is right over there. And you see that pink Post-it? That pink Post-it was updated this morning when I went to the gas station and filled out my gallon of gas. And I was like, it is no longer $4.61. It's $4.69. And if you go down the street, you'll find a gas station that is doing at $4.99. I learned my lesson. I don't go there anymore. But 2026 has been a year for the books when it comes to assessing the challenges facing families today. Price unpredictability, which I just encountered this morning, whether prices are going up or down, makes it incredibly difficult for parents and guardians to make long-term financial decisions. It creates instability, not just in the moment, but in the future. And when you can't predict or manage basic expenses, it becomes very hard to think about things like saving for college or other long-term investments in our children's future. Striving for a better life is almost impossible in survival state. But yet, we look ahead. This is the good stuff. Okay. In fall 2026, we will be releasing an interactive version of this data bulletin. And now I'm going to cede the floor to Brandon, who will tell us about some exciting data bulletin developments.
Thank you, Lynn. So I want to take a moment to talk about how we actually use data in our work. I know Lynn touched on a lot of the issues that we're seeing right now, but at WCA, we think about advocacy in two stages. The first is understanding. Before we can push for change, we need an honest picture of what is actually happening in our communities. The data bulletin is how we do that. It moves us away from assumptions and grounds the conversation in measurable outcomes, whether it's education, child poverty. All of these indicators come together to tell a bigger story. The second stage of our advocacy is action. Once we understand what the data is telling us, we could ask the harder questions. How do we make a change? One example is when looking at pre-kindergarten enrollment data, we see that Hispanic families in Westchester rely on public early learning systems at a disproportionately higher rate than their share of the population in the county. This is not just an interesting find, but it's an argument for ensuring that funding and access are meeting demand in those communities. So this fall, we'll be launching an interactive dashboard that will allow you to explore the data, filter by district, and see how different indicators connect, and basically give you as much actionable information as possible, as what you can see here. Data alone doesn't move the needle, but when we connect our insights back into policies, they help us understand what's going on and make plans on how we can change things. And yeah, I'll pass it back to Adam.
Thanks, Brandon and Lynn, for all the leadership you're bringing, and for the group here, if you haven't already, before you head out later this morning, you can spend some time with the slides as a sneak preview. Stay connected with Lynn and Brandon for ideas and feedback. All of the work we do, including the data bulletin, is done through partnership, so we really welcome and expect everyone to stay connected on these critical issues. So thank you again, Lynn and Brandon. Before we go into the heart of our program and hear from our wonderful panelists, I just also want to acknowledge Senator Shelley Mayer's office. Thank you for joining us today. We're neighbors in district and I'm a constituent, so glad to have you here. Thank you very much. One piece of housekeeping I didn't mention, the ladies' room, you all probably passed on your way in over there, and there's access to the men's room through the door over there. I hope I covered that. Hold on one second. Thanks. Okay, great. Thanks for forwarding this slide, so appreciate that. Tell me if you need me to do anything.
Sorry for this technical interruption.
That's our tech data team. Thank you, Lynn. I'll share some reflections about, again, why we're all here together from my vantage point, and I know that we share a lot of these as common threads. Children and families don't experience government support in departments. They experience systems, and today's about where those systems connect, where they don't, and what we can do better together for children and families. Across our county, there's already a tremendous amount of work happening within departments, across agencies, and alongside community-based organizations so well represented here, all to together support children and families at scale. And today's about building on that work, continuing to build. And let's identify where reaching children and families earlier before challenges escalate, and how strengthening alignment across our systems can improve outcomes for kids. We're also in a moment, it's not an elephant in the room anymore, where the tools shaping how systems operate, including and especially artificial intelligence, are evolving quickly. So part of this conversation can be how we use those tools responsibly, and how stronger use of both data, qualitative and quantitative, including lived experiences, can help us to act earlier, and more effectively. So in that spirit, I'm again thrilled to welcome our esteemed panelists, and you've heard their names from County Executive Jenkins. I'll tell you a little bit about how the flow will go for the next portion of our program, and then turn it over to our panelists to weigh in. So I'll have a couple of meant to be very open-ended, reflective questions that any or all panelists can weigh in on. I'll get to play timekeeper to the best of my ability as well. So please just raise your hand, and there's 3 mics to share. So I know all departments get along so well, so that'll be seamless. And then after a few sets of those kinds of open-ended, strength-based growth mindset questions on what we're doing well together and where we see areas to strengthen even more, we'll share the opportunity mic by mic, panelist by panelist, for some more targeted questions and their reflections about the work they're doing within each of their departments and domains. So I hope that makes sense. And then there'll be time for sure at the end for audience questions and reflections back to and with the panelists. So let's get started. Again, any and all of you can take these as you like and answer how you like. And if you have any personal reflections about what brings you to the work you do, please don't hesitate to integrate those. So 2 questions you can tackle how you'd like. Across your roles, what's one issue affecting children and families that, if addressed earlier, before challenges escalate, would reduce pressure across your systems? And/or, building on the assessments, data, and ongoing work that's already happening in so many ways across your departments, where could stronger use of information, again, both quantitative and/or qualitative lived experience, help respond sooner? So take a few seconds if you need to reflect, and then if anyone wants to jump in to break the ice, we'll welcome that.
Adam,
First, Commissioner John. Yes, with the next time, please.
Good morning. I know my audience, you can't say that, right? But before we get started, we're going to talk about a lot of services, but the lessons from the Knicks last night: 1, never give up. But for you all out there now, try to stay awake. That's the second lesson from the Knicks last night. I think you hit the nail on the head from the Department of Social Services perspective. Certainly, earlier prevention and intervention is key for us. And sometimes it's very basic. You're going to hear about all the services we all provide, but sometimes it's very basic. We brought together a group of family members of gang members in Yonkers a number of years ago and asked them what would have helped as your youth progressed through the system. And they said very basic things: after school activities, evening activities, opportunities, chances to connect and relate. So sometimes it's simple, it's common sense. So
Thank you, John.
Hi, good morning, everybody, and thank you to the WCA for always having these types of events. It's not often, believe it or not, that I get to share a panel with my colleagues, and I really appreciate that. And it's my first time on a panel, so I'm grateful for the invitation. I think right off the bat, the most important issue is housing stability, right? So when a family is already facing eviction, they're already a month behind. So you're racing around the clock to try to get them the funding that they need to address their arrears through a variety of nonprofit groups that may have some funding through the support of DSS. You're trying to get the judge, whether it's a local judge or a county court judge, to override the 72-hour eviction notice. So we have the services in place, but we have it when they're already free falling. When you see that with the trauma that they're facing, you're seeing that with the children's education worsen, their health outcomes worsen. So the message and the goal that we have to do is to try to get these services before families fall into the situation. It's something that I work on as Commissioner of Planning, but also my prior role in the nonprofit sector, helping families in need who are facing eviction. I know what the trauma is, I've seen it, and that is something that I would like to see improve in the years to come.
And I'll just echo in terms of community mental health, and first of all, thank you all for being here. I also want to thank my staff and Tori Shaw and her team. She is really the brains behind children's mental health. I get to get up here and talk about it. And I also just saw Legislator Joe Williams-Johnson and also joined us, so welcome, and a big champion of mental health and health. As everyone said, it's all about prevention, right, and early intervention, and what we're trying to do is really promote more screening and awareness for schools, for primary care physicians, and also giving the parents the school and knowledge and skills to be able to identify behavioral health, mental health, substance use challenges, and be able to connect. So prevention, early intervention, screening is still one of the most important things that we're trying to promote.
Good morning, everyone. Thank you again for being here, and to all the panelists and WCA. I wanted to kind of follow up on what planning was talking about in terms of housing. You may not think of health department being involved with housing, but one issue for us that if it's identified early can have a long-term impact on children, which is lead in homes. So when we're looking at housing, we do work with the planning department, we work with mental health and even DSS around these issues. So we're really trying to identify the lead hazards before children are in there and get them reading quicker, because if a child's lead poisoned, their IQ changes forever. And that then is a systems issue. They're in our early intervention program. They probably have in the mental health system. So that's an area that we're really trying. I know the governor has also put funding into Westchester County to sort of help us get our housing stock remediated and to reduce those risks.
So I'm Liz Oliveto. I work in the Workforce Development Board, and one of the things that I would love to see when it comes to being addressed earlier, we provide vocational training. We'll pay for young people to take vocational training to have a better career. We need to introduce that as an option earlier than when they're 20 years old. It needs to start as a viable option earlier, not as college, but that we have our partners in the vocational field. And that is a real career. Plumbers make more than I do. And they make more than a lot of people do. So, but we're constantly fighting that blue collar stigma by the time they are 20 years old. So even yesterday, I was in a high school explaining how this is an option. This is, come to me and we can do this. So I would love that to start much earlier so that it's just a regular conversation.
Hi, Good morning. That's working. I'm Susan Weissman. I am I'm in the Youth Bureau, and I also am the Food Security Coordinator for the county. So some varied perspectives on this. I just want to jump on something John said regarding DSS, and that is the gap, the after-school gap, when the time when children leave school and before their parents and guardians get home, which is a very vulnerable time for our young people. There's a much heightened chance of risky behaviors. With social media and the internet, they can become isolated and disconnected. And so the Youth Bureau supports after-school programs that not only provide skill building and educational opportunities, but have trusted adults for these youth, and they can make peer connections. And it's valuable in so many ways to have these after-school programs. Thank you.
Good morning. I'm Rachel Kotzur, Assistant Commissioner at Probation. I'm filling in for Rocco Posey, who couldn't be here today. So I just wanted to jump on the second question that you asked regarding data and how we can use it to get better programming and use it to inform the decisions that we make. So with probation, throughout the year, twice a year, we get data from New York State that is the Youth Justice Case Processing Reports, and we get that data about all the work that we do, and it's compared over years, and it's also compared to the work that's being done throughout the state. So we can compare the rates of our JD adjustment or the amount of youth put on probation, and it's compared across the state. So I just wanted to give an example of how we've used that in the past to inform our programming and decision-making. So around 2022, we reviewed our JD intake cases, and we noticed that 20 to 30% of our juvenile delinquency adjustment and appearance ticket cases. So 20 to 30% of those cases were youth that resided in residential treatment centers within Westchester. So just to give you an example, last year we had 545 juvenile delinquency appearance tickets, and 90 of those were from youth that were living in residential within Westchester. So that's around 15-16%, which is actually down, but it was very high. So a few years back, we reviewed that throughout probation, and we tried to figure out a way that we could better handle those cases and offer adjustment opportunities to those kids, because it was significant. And those cases were then coming to us as arrests, and because of their living situation, they were living in residential, they probably, a lot of them had prior juvenile delinquency adjudications. So we would, in the past, we would refer those cases to the county attorney's office and to the court. So we decided as an agency that we would try to offer adjustment to those cases. So we began doing more involvement of going into the residentials. We became more flexible with our supervision strategy. And so because of that, we looked at overall from the juvenile case processing reports was that I have the data right here, it says that about, so compared to the numbers in 2022, the amount of cases that we were able to adjust instead of sending to the court was up. Our rate increased by 9% in 2024, percentage points in 2024, and 7 percentage points in 2025. So if you actually look at the data and break it down, that's 40 to 50 youth that were given the opportunity and actually adjusted, and those cases were handled by probation informally. And we got services in place, and we shortened our time frame as far as when we were working with them, and we were able to keep those cases from further penetrating the criminal justice system. So I just wanted to give that as an example.
Thank you all so much. It's so crucial to hear your individual vantage points and then some common threads which we can continue to pull out. I'm going to shift to the next framing questions, which in the spirit of being together and staying out of our silos, well out of our silos together, and literally sitting shoulder to shoulder with your colleagues. We'll talk about systems and coordination as soon as I can move the slide. I also want to acknowledge Legislator Williams-Johnson. Thank you for being here. Thank you for your partnership around helping children, including as recently as less than 24 hours ago. Your health committee chairship had a crucial conversation on social media and our kids, so thank you for being here. Again, raise your hands, pass the mic. You all are doing great and appreciated. Some reflective questions, and if it starts to feel redundant in any ways, pull back from some of the themes we were already exploring. Where are you seeing some of the strongest examples of departments and partners, including public, private, government, nonprofit sectors, working well together to support kids and their families? And where could there be opportunities to do even better together? Any concrete recommendations or suggestions you have, you can call it before the 5th annual Commissioners Conversation next June, that you'd love to see happen, and maybe even ideas, whether it's technology or capital or human capital, that can get us there over the next year. So the floor is yours.
All right, Adam, I'll continue because I think Rachel's point is a good one, how systems can work well together. Your point about more, the number of kids in residential facilities that are at risk for further penetrating the system because we work on placing those kids. We have contracts with those providers. It behooves us to work with you and with those providers to figure out how do we prevent that from further. So I think those are opportunities, and I know Rachel and this whole team has been a part of our cross-systems coordination, not only on the ground, but now at the administrative level with the Children's Cabinet, which we really gained momentum in 2022. And it's really gonna help us better understand, because there's no shortage of services out there. We did a mapping, and Tori, as you said, Michael, was instrumental in that. And we identified in Westchester County alone, $1.2 billion worth of services every year that are provided to children and families. So there's no shortage of opportunities. It's how we work together in these examples to make sure that, one, we're understanding what each other provides, but identify gaps and figure out how we can continue to work together. So I think those are opportunities that data and working together can bring.
Yeah, I just want to build on what John said, and many of you know, Westchester County is known for our children's system of care, meaning how we work together. And that's even during challenging times or significant changes. We know things have changed with Medicaid redesign that impacts the mental health, substance use system. We know the Family First Act. We also know Raise the Age. These are significant influences in our system that sometimes naturally come together and sometimes create more silos. But we've been steadfast, and it starts from the leadership, it starts from our county executive and the operations team, and it trickles down to our departments, and most importantly, it also includes our providers. Westchester is known, if you're ever bored, there's a meeting that day. So we do that strategically. Seriously, the reason we do this is that we're all on the same page, we're using resources appropriately, and it starts with our community networks that started in 1989. We have a community organizing model that has been researched by Israel, Europe, to see how we organize as a communities. Guess how much it costs? $0. It's all of us coming together with our community leaders to plan. We have a meeting that started in 1991 that meets every month, and we also have subcommittees. There's one partner that's missing here, and that's probably been our greatest strength, is our school districts. Schools play a significant role. Thanks to our county executive's office, we have a person in our office who actually goes to community special education meetings, meets with parents in schools. So schools are critical, as we all know, and there's been investment to have them be part of the work we do as well.
Sure, and then I will say there's two main examples to address this question. One would be the Welcome Home campaign. If you can raise your hand if you're aware of that campaign. It has really been critical in terms of providing awareness and actions with respect to affordable housing and the development of affordable housing in municipalities throughout Westchester County. Unlike my peers, my department planning is not an operating department, but what we do is provide data that is used for advocacy purposes, for data dashboards to inform communities about a variety of issues, whether it's housing, whether it's transportation, whether it's school enrollment. And the Westchester, the Welcome Home campaign has been extremely critical in joining and bringing together representatives from various sectors, the government sector, nonprofit, private, all to come together in one voice to say that there is a critical need for housing, specifically affordable housing. A decade ago, you would not be seeing these types of relationships, and I truly appreciate that that has come on board and has been a strong presence on that. The second example I would say is Home Seeker. Home Seeker is a platform that the county, through county funding, the Department of Planning enhanced and launched a year ago. Actually, it was May 8th, so it's happy birthday, Home Seeker. We enhanced this platform to provide an opportunity for anybody who's interested in looking for affordable housing opportunities, not only to identify these opportunities, whether rentals or for ownership, but also to apply online. So this cut back on the need for people to have to race around from one place to another, trying to submit their applications, trying to gather all their paperwork. We wanted it to be a one-stop shop in providing that service. What we did as well, not only provide training to folks that wanted to navigate the system, but we also provided training to nonprofit providers so that they in turn could assist folks who do not have access to the internet or may be a bit confused as to how to go about applying for affordable housing opportunities. This is a partnership that we worked alongside Westchester Residential Opportunities as well as various developers to be able to provide a wide variety of affordable housing opportunities for folks who are in need and who are looking for to live in Westchester and in an affordable means.
So, okay, just to let you know, what I do is I oversee programs for youth who are 16 to 24 years old to help them get jobs. One of the things that we have to do is provide supportive services. So with this funding, we're supposed to find employment, vocational training, and supportive services. When we talk about partnership, in addition to the government that you see here, Westchester County funds a lot of nonprofits and a lot of organizations. I've never had one of them say no when we reach out. You know, these are the things that we need to augment the programs we run. So when you have kids that need clothes for an interview or clothes just in general, we go to the sharing shelf. We have partnered with Operation Prom, and we're creating Operation Career Closet so that kids can go there when they need clothing. Citizens Bank, who does a far better job at financial literacy training than I do, and with all respect to my partners, they do. And that takes the burden off of them. When I've reached out to the Youth Bureau, we do partner on different things. Like when your youth leave this program, they come to my program. So there are pipelines, they're human-created pipelines, it's relationships. But we find those opportunities and bring them together. So that's what I was gonna say, there's plenty of examples of how we all work together. When I walked in today, that's exactly what you said to me, so I'm gonna pass the mic. Great, there you go.
And what we're seeing in the Youth Bureau as well is nonprofits that we work with and support, many of whom I see in this room actually, are doing an amazing job in these current difficult and challenging budget times of pooling resources, of partnering amongst themselves as well to provide valuable services to youth and expand access.
We're going to shift to our next section, and thank you all again for your unique and common reflections to those open-ended questions. I just also want to acknowledge and thank Legislator Nancy Barr for joining us today and for all of her partnership work and leadership throughout the county. Thank you, Legislator. A few reflections, some of which were alluded to or shared by Lim and Brandon earlier, and again, the data bulletin sneak preview are posted on that side of the room, and the bulletin will be released shortly. And probably no surprise to anyone in the room, either through your professional and or personal vantage points, but we're seeing rising cost pressures for children and families. This was mentioned earlier as well, including housing, food, transportation, gas prices, Lynn mentioned, and childcare. Alongside declining birth rates, fewer younger children, and growing mental health needs. Across departments and community partners, there's already strong work underway to respond. You're hearing some of those examples, and we'll hear more in a minute. The opportunity is to better connect those efforts, anticipate needs earlier, and strengthen outcomes for children and families across systems. So in that vein, we'll now have an opportunity to do and hear a bit of a deeper dive from each of our leaders, reflecting on their work. And again, any personal reflections back to your work, please share. And we'll start from the right and welcome Commissioner Lopez as a first-time panelist. Thank you for being here. So we'll start with you, and then we'll move to the left. So please take 2 to 3 minutes in your own way, shape, and form to reflect on how are housing, transportation, and land use decisions shaping access to opportunities for children and families.
Thanks for the question. Housing, transportation, and land use decisions are the most consequential decisions that or choices that municipalities make. And these three systems do not operate in isolation. They really form a framework that either opens the doors for families to come and live in their municipalities or quietly closes them out. So where a family can afford to live determines which schools their children attend, which parks they can walk to, and how safe their streets are. Land use decisions, which is what we allow to be built where, set the conditions for that housing. And transportation essentially connects it all. You know, determining whether a parent without a car can get their child to the doctor's office, or whether a teenager can take a bus to an after-school job, or even attend community college. When municipalities zone exclusively for large lot, single-family homes, they effectively limit who can afford to live there. And which means that children from lower income families are then living in communities with fewer resources. There's data from the Regional Planning Association from their a report from last year that shows that the majority of permits that were issued by building departments was mostly for single-family homes up until 2008. And more recently though, since 2016, permit data reflects a shift towards higher density housing and transit-oriented housing as well, which is a good sign, and we have to continue to make sure that that shift continues. For us at the county planning department, under state and county law, municipalities are required to refer to us their proposed zoning and planning actions, and the county planning board will then review and provide comments or feedback on those proposed actions. And this referral process gives the planning board a lever, right? We can flag proposals that do not account for regional housing need or transit need or access, and we can work with municipalities to find better outcomes. Again, these are just recommendations. We cannot stop a proposal, but we can certainly have that conversation with municipalities to let them know about what is the need at a regional level, as opposed to just looking within one particular jurisdiction. On the transportation side, I also serve on the MTA board as the Westchester County representative, and I can tell you that transit access is a children's equity issue. A bus route that doesn't run on weekends or a train station that is hard to get to by walking certainly limits where a family can realistically live and thrive. And when we plan for transit, we have to ask, can a child in that community go to the library, go to a summer program, to a job? And if the answer is no, then we're making a policy decision that is becoming consequential in the long run.
Thank you, Commissioner, including all of those specific grounded examples. I really appreciate having you at the table, literally and figuratively. Turning to Commissioner Orth, and I know your tenure, you've seen shifts along the way, so any reflections you have on where together with your leadership and your team, we've made progress towards earlier, more preventative support for kids, and where is there still an opportunity to do more?
Did Adam just say I was old? My 10? I was thinking, 33
Legacy
years.
tenure.
Anyway, thank you. One of the things I'm most proud of is the actual title of our department. It's Department of Community Mental Health. And when you think about prevention, early intervention, we have a fairly robust mental health system. I see Darcy Miller from Greater Mental Health in New York. Thanks to the governor and elected officials, we have more crisis services. We now have youth ACT teams. These are the more intensive services that many of our children and families really benefit from. But when you think also about the community aspect, it's how we develop, connect with those credible messengers. And I see Caitlin Leon from WJCS. We've grown mental health first aid, whether it's teen or youth. Every school, every community hopefully is aware of mental health first aid. Stephanie Marquezano is also in the room. See if she moved. We're doing so much work with co-occurring disorder, with young people, with helping them understand the impact of mental health substance misuse, and working with the faith. Pat White is not here, so that means she's on a cruise or she's in a church probably. But she's done such great work with our faith-based leaders, because that's a place of healing and hope. And just like mental health, if we can partner with them, that's what prevention is truly about. And I mentioned the work with schools. Thanks to Tori and so many school leaders, we now do multi-tier systems and supports, which really looks at how do we embed mental health, wellness prevention for all students in a school building. And with that, we have over 76 school-based satellite clinics in Westchester County, where young people can access those services directly in their home community. But then there's also sort of the unsung heroes. And I see Mr. Anthony Gaines in the back from Greenburgh. This is a man who exposes his young people to CODA clubs, to mental health. And that's really our goal, is to really connect with the credible messengers in the community like Mr. Gaines to really impart mental health and wellness and prevention, because that's where it's also going to be sustained. So we see that as one of our mission in the Department of Community Mental Health as well.
Thank you, Commissioner. And please stay young and stay youth-focused as well. We need you. Turning to your counterparts in the health department, Renee, which child health outcomes most depend on coordination across agencies, across community partners, including probably, again, some or many in the room, and where are you seeing that working well today?
Honestly, I think it's all outcomes. I don't think, and as our county executive said, this cannot be done alone. We really all need to work together across the government and with our community partners. I actually had a different thought when I first was coming here to speak, but it really has to start with birthing healthy babies, right? We've got to start from that moment when they were entering the world. And the county has really invested in some maternal child health initiatives where we're seeing some really positive outcomes. And again, it was not done just by government alone, but it was working with the community partners, the trusted messengers, to really build some really positive, I think, steps going forward to improve outcomes. Two other areas that I want to focus on, and it's interesting, you know, we as a health department are required to put together a community health improvement plan. It's a requirement of hospitals, it's a requirement of local health departments as well. The focus has really shifted to not just saying, okay, let's get more kids vaccinated, or we're going to address this one particular health issue. It's really working around the social determinants of health. I can tell someone they need to get doctor's visits, but if they don't have proper housing, proper food, the main pillars you need to survive, the message I get out there is not going to be very effective. We are working and partnering with people even on this panel around really improving food security for families, getting them healthy food, really trying to work with pantries around when people are making donations, what are healthy, good options that people can donate to really ensure that we're creating healthy families. The other thing I want to focus on, because I think I'd be remiss not talking about, is health insurance. The changes that are coming are frightening to me, to be honest. I don't think people understand. People want to attack Medicaid. I don't think they realize our healthcare system is so dependent on those funds. And it's going to affect people who think that they're fine with government, commercial insurance. And I think for us as government, we may not have all the answers, but I think it's really trying to get out information. I think requiring people have to now to recertify twice in a year. It was hard enough to get them there once. It's an attempt to really, I think, lose people's health insurance. But we're not going to let that happen. And we have a strong navigator program, outreach program. We are really committed as a health department to working with our colleagues here to making sure that we are educating families and helping them, referring them to places. And if those who don't qualify, we're going to make sure our federally qualified health centers, that people know that's a resource to them, that the county does support and provide assistance to. So I think that's.
Thanks, Renee. Thank you for stepping in and being here. It means so much. And as Rachel, as you said, stepping in as well. Thank you for being here and adding your reflections on behalf of the Department of Probation. So please share with us your thoughts on where can earlier intervention, and you may have touched on some of this in your thoughts earlier, make the biggest difference in kids' lives and youth lives? And how can partnerships expand to support stronger pathways for youth? Anything you want to share?
Thank you. So in 2022, New York State enacted the Raise the Lower Age legislation, which raised the age that a youth could be charged as a juvenile delinquent to 12. So before it was 7, so now it was raised to 12. So probation doesn't have cases of youth under 12. Those cases are handled through social services and community-based mental health services. So when we get a case of a youth that is 12 years old, that's the earliest that we would get them, and we work diligently to try to prevent them to further penetrating the criminal justice system. So following every juvenile delinquency arrest of a youth over 12, the youth and the family is given an appearance ticket appointment at probation. So the youth and the parent has to come to probation, and our probation officers meet with the youth and review the paperwork from the police and review the arrest. And we review the case to see if it's suitable or eligible for us to work with this youth under our juvenile delinquency adjustment process, which is the process where we start working with them immediately instead of referring the case to the county attorney's office, to the court for further processing. So most of those cases that when we review the case and we review that it's suitable, our probation officers can start working with that family immediately at that appointment. So that means after an arrest, within 1 to 2 weeks of the arrest, a lot of the cases we start working with immediately, which means that interventions and accountability gets enacted immediately. So I think that makes a huge impact on the youth and the families, because we realize that getting them in and getting the services as early as possible means that they're going to be more engaged in the services, and it provides long-term positive outcomes for the youth, as opposed to waiting for the case to go through the court process, which can take 6 months, a year, and then the arrest was a year before, and the youth, a lot of times they weren't held accountable during that time frame. So we realized that the accountability measures and services, getting them implemented immediately, can make a huge difference on the family. And as part of the JD adjustment process, probation really focuses, and on all of our supervision cases also, we focus on positive youth development. So we understand that positive youth development and opportunities for the youth to strengthen the protective factors and the positives that they have going on, and reduce and add in different experiences for them, will reduce the likelihood of further criminal justice involvement. So our officers will meet with the youth, and they come up with a plan, a case plan, and the case plan is collaborative. So it is involved with the youth's interest, with what their services that them and their families need. And we try to include the positive youth development that's geared towards that. So we can't do anything alone. We need everybody here at this table, and the Parks Department, the Youth Bureau. We bring our youth to many of the Youth Bureau events that they have going on. We brought a bunch of kids to a few of the Westchester Knicks games this year, and this is stuff exposing them to things that they would never have been seen before, because we just know that even if we've given them tickets in the past, they're not able to get there. So our officers go with them and pick them up and bring them to these events. We also do that with community service. So we work with Muscoot Farms and other parks in the county, and we pick up the youth, we bring them to the farm, and they've never seen a chicken before, and different things like that. So, and then it's restorative justice, giving back. And so it's really important for what our officers do. We bring them to job fairs, we bring them to career fairs, college tours of WCC and local colleges. And we also work very closely with parks, and we get jobs for our kids. We'll bring them to the job fair, and our kids, we've had one of the past job fairs for Playland and the parks. We had 4 kids walk out. We brought them, we encouraged them throughout the process, and then they walked out with conditional offers of employment. So that's really making a difference in these youth, and we understand that doing that early on and being really involved with them is what makes the difference. In addition, we work really closely with all of our community partners. We work closely with student advocacy, and we are on meetings constantly with the state and with different people in probation throughout the state and the courts to try to come up with innovative ways to expand what we do offer and what works, what doesn't. So we really focus on what we can do and how we can expand to offer the best opportunity for these kids to become productive members of society and to not recidivate. So.
Thank you, Rachel. Assistant Commissioner Kotzur. And now, First Deputy Commissioner Befus, John. Your reflections are so welcomed, and we all know that the Department of Social Services is a hub for kids and families across the county. So your reflections are particularly unique for this conversation, and would love to know from your tenure and your vantage point, what are the biggest pressures facing children, and how can resources like the Children's Cabinet help departments act sooner and work more effectively together? And maybe it's also with community-based organizations as well.
Oh, absolutely. Thank you, Adam. Let me reflect. Now, I'm right there with Michael. So, Michael, approaching my 20 years. But anyway, on behalf of Commissioner Townsend, Darcy Miller here was also a former commissioner, so she understands this all too well in social services. We're large. We're a $750 million department in Westchester, and we think about those services. There's many different services, you know, across our department, 18 major programs, but we think about them in different categories. And sustaining those foundational safety nets for kids and families is critical at this time. You alluded to it, Renee, but with some of the basic needs around food, healthcare, and shelter. The SNAP program provided last year food benefits to $181 million with the food benefits to 65,000 Westchester residents. That's what's at stake from a food perspective, and I know that Susan works on that every day. Medicaid's even a bigger program, 230,000 Westchester residents on Medicaid, and with the expanded Affordable Care Act and positive things that have helped expand that program, it provides $3 billion worth of services in Westchester every year to those residents, $3 billion. So critical times for those programs, and we're gonna continue to help link not only those residents, but those residents that are facing losing those programs through engagement, work activities, the kinds of things that will help preserve those with the federal changes to those programs. The other thing that we do, and really cuts across a lot of different areas, is the public assistance program, and now particularly focused on housing and eviction prevention, which provides more than $30 million worth of services to residents to support, to preserve housing, prevent evictions, fund youth and family employment services, and provide support for rent, utilities, food, and clothing when individuals are on assistance. And that's expanded further with the advent of the Office for Housing Council and the legislative support out there for that, and so in the administration support. So those are critical basic needs. But unfortunately, as a result of that, on any given night, we can have 350 families in shelters. And that's not good enough for us. We really have to move families and individuals and children to self-sufficiency. So we don't just stop with the emergency shelter. We also provide 200 scatter site housing units that help transition families from emergency shelter back into their communities with the supports they need to be self-sufficient. I see Laura here. We'd be remiss without talking about our fastest growing program, which is childcare, investments in childcare. Last year, that program provided childcare supports and to more than 5,000 slots at a cost of $85.5 million. We've had to, unfortunately, freeze the program temporarily while we get additional state money, which we expect with the governor's budget. But that program could easily be a $100 million program, and we're gonna need to continue to advocate for support at all levels. So even though there's local investment, there needs to be continued support from the state and federal level as well. So we certainly know that's a critical program. The other thing is addressing the high rates of domestic violence. As Deputy Matos knows here, as many as a third or more of our child protective reports that come in every year involve domestic violence, and one of the innovations, and again in partnership with our Office for Women, has been to implement the Safe and Together model, which takes a different look in our child protective world at domestic violence, much more child-centered, strength-based, and seeing victims of domestic violence as partners, not perpetrators, and holding the actual perpetrators accountable for their behavior in those cases. And then lastly, other investments in the child welfare world, really working again cross systems. I know Michael was instrumental in helping us in 2011 form the cross systems unit with Rachel's probation department, mental health, and us, where we're really intervening earlier and providing preventive services to children and families who are starting to penetrate our different systems. And as a result of that, we've actually seen tremendous outcomes. We've reduced the number of children in foster care by 45% to 303 children. At one time, many of you know, that was nearly 1,000 children in foster care. And as a result of reducing those, we can reinvest the money that we spent on those programs in preventive services. And so we've increased those preventive services by $5 million with the support of this administration to $15 million now, so that we're helping to fund the community providers that provide those essential early prevention and intervention. So those are some of the things that we're really trying to do and bring together our systems to continue to provide it critically.
Thank you. It sounds like more than trying you're doing, so thank you, John. Elizabeth, Liz, thanks for being here. And I know, we know that you commit so much of your time and energy for workforce development for our youth. So we'd love to hear from you what might, or I'll say what would, could, should be a stronger, earlier pathway from school to economic mobility. What could that look like in your vision? And how can other systems, whether it's government, nonprofit partners, corporate sector, how can we all better connect to that vision?
So the first thing is that young people don't know what they don't know. So you can't expect them to say, I want to be an x-ray technician, or I want to be a phlebotomist. They don't know what those things are. They don't know how to get there. They don't know what it will give them. They know what they see around them, and they know what that will get them. So one of the things, most of my programs are for older youth, but in the program I run for younger youth, we had a company called Pool Nerd. We partnered with him. And it's amazing what they did. So we identified that you don't know what you don't know. And they will come in and do these career pathways from when you're in high school and junior high school. If you start taking these classes, that will prepare you for this. Or with just a high school education, you could become an x-ray technician by taking this test in this place. And then when that happens, here are the entry-level jobs that go with it. It's very concrete for young people. Otherwise, you have to make it very tangible. So when you become an x-ray technician, you can work in a hospital, you can work here. This is how much money you'll make as an entry level. These are the advancement opportunities, and this is where your salary will top out. And then with the economic mobility, when you're at the entry level, you could rent an apartment for this much money, and you can afford a car payment of this much money. And after 5 years, if you take a different test or you get a different certification, this is what you can afford. And then we partner it, like I said, with the financial literacy from Citizens Bank, and they talk about things I've never heard of, but a lot of it is avoiding scams, especially for young people. Like I was thinking it's checking accounts, because a lot of our youth don't even know what the numbers on the bottom of their check mean. And the difference between a check cashing facility and a bank. And then as you get older, right now you can't take part of your salary out when you're 19 years old and you're helping your family pay their bills. But when you reach this amount of money, if you just take this much out and put it into a different account, it will net you this in the future. So we've tried very hard to make it concrete, and this is what you can do. And it's not insurmountable. It's not 5 years of schooling and then another 2 and then another 3 years on the ground. It's take this test, and that's the entrance to these professions. And I say the x-ray technician because I was blown away. You could be an x-ray technician on a cruise ship all over the world. And I was like, that sounds good. But it does, so that's what I mean, you don't know what you don't know. And it opened a lot of doors. So I think with programs and trainings like that, that lay it out so nicely for young people, we show them what's possible, and it's not insurmountable. I would love for those to be, these type of trainings, these type of promotions to be put into schools. I can only reach so many kids. In my summer youth employment program, we reach about 350 kids. The youth employment program is about 400. There are a lot more kids. I would love for that to be taught to every young person, that this is an option for them.
Thanks, Liz. You had us an x-ray technician on a cruise. So
Yes.
I know.
One of our key partners in child advocacy across the county is the Westchester County Youth Bureau. And Susan, thank you for stepping in, and some reflections from you will be welcome. What opportunities are making the biggest difference for young people in Westchester, and where could access be expanded?
I just want to say the Youth Bureau has done financial literacy programs for our youth as well, and I found myself taking a lot of notes. There's really a lot we can learn at all ages. Putting on my food security hat for a minute, I want to say that I see what families, I'm out and about, I'm visiting organizations, I'm visiting food organizations, youth organizations, and I see what youth and their families are experiencing with the increased costs these days and the impact of the federal cuts. And on a personal note, I just want to say that I feel very fortunate to live and work in a county with a county executive and administration and these departments that are we're all doing our best to fill those gaps and meet the needs. So on a local level, that's very important to me. The Youth Bureau's work is grounded in positive youth development programs, and we provide close to 200 programs for youth throughout the county, including our tax levy, county-funded Invest in Kids funding, and big shout out to Westchester Children's Association, who has been one of the Youth Bureau's biggest allies and champions from the very beginning of that funding, so thank you. We also get funding from the New York State Office of Children and Family Services for positive youth development funding and for sports programming. And in addition to our technical support and funding, the Youth Bureau provides assistance in other ways, like capacity building, resource and information sharing, and our office has the county's runaway and homeless youth coordinator in our department. My colleague Kate Hubert is sub. So in addition to all of that, we bring youth and nonprofit partners together for various events, including our MedTech and Finance Conference, where we teach about careers in healthcare, technology, finance, our Invest Fest, which highlights our county-funded Invest in Kids programming, and our International Day of the Girl, My Brother's Keeper, lots of things that are engaging and interactive to actually bring youth together for positive youth development. I also want to say that one of the things we have seen, and I know research has shown, that mentoring and mentorship programs are crucial for young people, and the outcomes for their social, emotional, and economic development are much greater when they have these trusted relationships. I mean, think back, probably most of us in this room have had, when we were younger, some adult, some caring person who mentored us and provided support, and that can really make all the difference. So we do understand the importance of youth voice as well, and that's really critical in our work. We encourage all of our partners to involve youth, to get their input, because it's so important for youth to feel invested in their programs and to ensure that they have access. So thank you for having me.
Thank you so much, Susan. Thanks for being here. Appreciating the panelists' energy and time and the warm seat in the audience. So we're going to keep moving. We'll have a few more reflective framing questions and then time for open questions from the audience to the panelists, and then if any of the panelists stick around and you wanted to talk more to them, if we don't get to your questions in the room, please do. It's been particularly great to hear how use of data, quantitative data, is driving so many of the decisions and framings in each of your areas and shared areas of work, and also the lived experiences, and you've highlighted not by name, but we can all picture the kinds of kids and families that are counting on each and all of us for support. So in my best attempt to synthesize some of that, we've been talking about intervention and coordination. So a two-parter, and again, a few of you please weigh in as you care to on what are some steps, areas of the next 1 to 2 years where you'd like to see even more coordination to strengthen outcomes. And I mentioned at the beginning the not elephant in the room, AI. Would love to hear any reflections, fears, concerns that you have about how this tool, technology, can play a part both in healthy outcomes for kids, but also recognizing that we need to be thoughtful about guardrails is the term we'll use, which may include impacts on service delivery and also our human workforce. So again, open to all panelists. Please jump in. I see Commissioner Lopez ready to go.
I can start it off. With respect to a concrete step, I look forward to the dashboard that the WCA will be releasing later this year, and I would love for the WCA to do a briefing with our county planning board, because what we could do is embed children and family outcomes within the land use decisions that are being sent to us for referrals, right? Another concrete step that all of you could do is keeping in mind that in our municipalities, all of our zoning and planning commissions are volunteer driven. How great would it be to have members on these commissions that have representatives who are advocating for family and children outcomes? And how would that impact and change in the long term the land use decisions being made in those municipalities, right? So that is something to think about. There's always a great push to diversify our local planning and zoning boards. So it's a really great opportunity to get involved and just make your voice heard in very impactful decision making that is being done. I think that's it for me now.
Thank you. Thanks for the invitation.
I can add one thing that I think is something we're just starting and we really want to enhance going forward the next couple of years, and that's working with these partners right here, particularly probation and mental health, on what we call single point of entry. And those are, again, youth that are at risk of placement out there, some of the hardest to work with, that sometimes fall through the cracks because nobody knows what to do with them. They may have significant substance abuse, significant mental health, developmental disabilities, cross systems needs that without being addressed, they continue to just be a challenge and not get the full services they need. So as a team now, we're beginning to actually staff those with commissioners, deputy commissioners, assistant commissioners at the table, talking about what those individual youth needs are and how our different systems can best support and serve them. So I think that's an important step we're going to take forward.
I want to take on AI.
There you go.
So, again, I embrace technology, but I love the use of the word guardrails, because I do think AI has been a tool that can help people do their jobs more efficiently. We see where it can potentially eliminating jobs. So I think for our youth, it's a lot of confusion. What career path? I mean, I've just graduated from a 4-year degree in coding. Maybe I don't need that job anymore. It's been replaced by AI. So I think it's really trying to help our youth figure out how do we move forward for jobs. The other piece of it is on the safeguards. I think people need to be trained that just don't take AI as the be-all trusted messenger, because we can influence AI. You put enough stuff out there, that becomes the norm. And from a health perspective, you get people saying anti-vax, 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 and AI can come up with that's what is being chattered. So I think we really be very careful, and as a government agency that has a lot of data, I think we're again, I commend our IT department and really putting out some guidance to us about being very careful about what is shared, because it becomes, then public domain, so.
Just related to social media and technology and AI, I had the humbling experience a couple of weeks ago to sit on a very prestigious panel in New York City with tech people who basically did an autopsy on 6 young people who died by suicide as they got more engaged in algorithms and the influence of the algorithms, which led to them completing suicide. Again, I think there's aspects of social media to help young people connect that can be very positive, but when they walked us through the algorithms and how easy it is for young people, especially who are more influenced for a lot of reasons, to fall down that path and journey, I think we all have to be extremely alarmed by it, and not also educating our parents. I do want to also give a recognition to Legislator Barr, who's working on a Disconnect to Reconnect initiative, where they're trying to find balance, they're trying to delay the use of social media and various platforms, but also go back to some of the alternatives that our young people so desperately want to participate in as well, that don't involve technology. So thank you, Legislator Barr.
in my programs, I have a slightly different approach to AI. And we use it as a tool, especially because it is an equitable tool. It's free to everybody. So when we use it, for example, to brush up on interview skills. So when you do a mock interview with somebody, we record it, or you can record it, the young person can, and then you feed it into an AI engine. And you say, polish this up, or how can I say this better? So it's your words, it's what you produced, but it's gonna help you learn how to present yourself better. And then once it's in there, the young people before the interview, you could listen to it as many times as you want to. So you can hear your answers that are polished, so you're more comfortable with them when you go out and you give your answers. You can also speak to an AI search engine and say, this is what I've done with my life, and it will help you build a resume if you don't know anything about how to build a resume. It will also ask you questions that will pull out more information that you never thought of putting in a resume, especially when you're 17 and you've done almost nothing professionally. So it will help you, but we use it a lot in the programs as a tool that anybody can use, not to replace work, but to help polish work and to help you put your best self forward. So we kind of embrace it. Mm-hmm.
Maybe I should have put my remarks through
I just want to jump in and about what John was saying before about the single point of entry meetings. So on a daily basis, our probation officers and case managers talk about cases, but we're taking it to the level of senior administration where we're reviewing these cases from our level. And so it's a different point, and we just started those meetings, and we're, a couple weeks ago, we had a case that I called them all and said, I need to meet with you right this week. We need to coordinate our schedules so we can talk about this case because we need help. And so that's something that, we've always been able to do that, but calling these meetings and doing them more regularly is something I think that's gonna be really beneficial to the families and youth that we work with. And about AI, so in probation, we're very hands-on and in person, and we do home visits and we have the youth report, but we do have serious concerns about AI and what it'll be used for, and we try to make the youth aware of the dangers. We run groups with them about cybersecurity, about AI. We've had a case where a youth created a sexual image of one of his peers and disseminated it. And so that's going to be happening more likely. So we are just trying to make the youth aware of the consequences and that they could be charged with different things. So that's the part that probation plays, is trying to create the awareness in the youth.
Just a quick note on AI, I think the work that the government does with people is based on trust now more than ever, and human connection, and that is something that AI can never replace. So it is just something very important to think about as we do embrace AI, because it does make our work efficient and it saves us a lot of time and perhaps some money, but the work and the essence of why we're here and what we do, the things we do, is to help people, and with respect to the relationship, that is something that has to be done in a human connection.
And on that note, and then I'll turn it back if there's any last reflections on this topic. I used an AI chat to create these questions, so any clumsiness, I'll take the human blame, not the robot, but it's really, we're fortunate to have such grounded, compassionate, and professional vantage points from each and all of you on these issues, which seem to be moving more quickly than ever, so appreciate that. Were there any other last reflections? Otherwise, I'll move to wrap up my questions for you all with thanks, and then you'll get to hear from your colleagues and friends in the audience. So now's a chance to dream big when we're sitting here together, hopefully maybe with the head of the IT department, if that'll make sense, at our 6th or 7th annual commissioners conversation, so 27, 28, 2029. Think big, dare to dream, it's a safe space. How are we gonna know that we've made real progress? And what would kids and families' lives actually look like, and what would they be experiencing differently 2-3 years from now? And is there one measurable change, however you want to measure that, that would show that we've improved not just the coordination among ourselves, but some of these real pathways to opportunity and long-term well-being? So again, to each, any and all of you, with thanks.
I guess I'll start from a mental health, behavioral health perspective. There's a data point that's out there that from the time a person first experiences a mental health symptom to the time they actually get professional help, it's 10 years that have gone by. So imagine if you had a broken bone or a flu. I know some of you guys might know my daughter out there. Whenever she has a cough or cold, she goes right away to urgent care. Don't tell her I said that. But it's, you know, urgent care, they're right across the street, they're available, they're there, you go, checked out, nothing's wrong. Okay, if something's wrong, you go back. Imagine if you're struggling as a 10-year-old with anxiety, depression, starting to maybe misuse substances, and you don't get that immediate, timely, effective care. It leads to co-occurring mental health substance misuse, it leads to cutting and living in silence. So if we could create a system where there's easy access, and that's going to involve really two things: health insurance parity, although it's on paper, it's not in reality. There is not sufficient network of providers. There's not a sufficient provider of racially, culturally, linguistically proficient care in our behavioral health system. So that's got to be actualized. And the second thing is a commitment and dedication to our workforce. We have to have folks who are passionate about the work, who are compensated for the work, who get pleasure and support out of the work so we can retain them. So again, hopefully 4 or 5, 6 years around, Adam, I hope to still be here, God willing, that we will see that it'll be easier, just like with every corner of a street now has urgent care, that you will be able, if you speak to Mr. Gaines or a teacher and he says, you know, I think there's a place we can get you easy care, that it's right around the street corner, no waiting list, and not just access to more care, but quality care as well.
Adam, I think what I'm thinking about, and I know Commissioner Towns, who couldn't be here today, would say that, and speaking from the heart, I think we couldn't ask for more than if we actually had families and youth sitting up here talking about how these services that you provide, that we all provide, have made a difference in their lives and what we could do better. I think hearing their voices and hearing those firsthand accounts would be a dream and a hope for me, because we could talk about the programs, the data, the statistics, but ultimately, as the commissioner said, it's about the connection and the outcomes in kids and families.
Thanks for lifting that up.
Yeah.
Any other reflections from our still high energy panel? Thank you.
We want to hear from them.
Yes, let's hear from each other then. I'm under the impression probably we don't need a mic for the room, so I'll call on people. Okay, good. Then you can have a mic if you like it, and I'm going to do my best to keep it tight. We'll go from Lauren Newman and then start working our way. And if we don't get to your question and the panelists have a few minutes afterwards while you're having snacks and coffee, please talk about it.
Thank you, John, so much for bringing up childcare. I did want to invite all of you to think of childcare as a more holistic approach and how it interacts with all the systems. In Westchester County, we have over 850 childcare programs. Half of those are in people's homes. And we have the Patrick and Dolores Hogan, I believe, are here today. They run probably the only reliable overnight childcare program in Westchester County. So if you think about people who are running a home-based program, if they start losing income because money is stalled at the state level, and God knows what's happening with the feds, etc., people are now, who run programs are now in danger of losing their home and their business, and all those children and their families are now impacted. The level of stress for parents who have to rely on childcare, my colleague Lauren Perkins came running in, oh my God, childcare issues this morning, right? Every single meeting I go to, somebody is either running in or running out because they have a childcare issue. The level of stress for parents, which then reflects on the children clearly, and the childcare providers, is enormous. So I'm now one of those people who says I have a question, but I really had something to say. I never do that. But I do want to ask that you all try to remember that piece of how that integrates with health, mental health, huge, housing, everything. Thank you.
I just want to add to that because I had a conversation with the New York State OMH, Office of Mental Health Commissioner, about a positive note, the expansion of childcare and the importance of it, especially with some of the new funding in the governor. But that also means that we're going to have more young people, perhaps, who are in these settings appropriately, but some of their mental health challenges, especially after COVID. And thanks to our county executive, we fund Early Step Forward, which is a program that's embedded within some of the daycare, early childhood settings. That's being funded totally by the county. And what can we do to look at either a insurance reimbursement, or what can we do at the state level? We put our proposal into the state about this model because it's so effective, thanks to some of the agencies, Family Services of Westchester, WJCS, the Guidance Center, but there's going to be a greater need to, as you said, support some of those young people who may be dysregulating or maybe a new experience to them, so that's something to think about.
And Laura, I'm glad you mentioned it's not just child enrichment, but in our world, it's also an employment program to allow individuals to go to work.
And Megan, others, please feel free to introduce yourselves in case there's new connections in the room as well.
Oh, thanks so much. Hi, I'm Meg Koifer from the STEM Alliance. Liz, first I want to provide a little correction to your language because I'm certain you know this. AI is only equitably available if people own devices, have internet, and know how to use it. And so what I wanted to talk to you all, we just partnered with the county and released a study showing a 4-to-1 on our digital access programs with the county, 4-to-1 return on investment, a large portion of which was wage premium improvements, access to health at lower costs. So when we talk about insurance going up, we save. 94% of the people we're working with do not own a personal computer. 60% have no computer in their home. Last fall, we got a desperate phone call from a school district. They had 135 children who could not take the SATs because they didn't have computers. Those kids did not take the SATs. So I just want to know, how can the STEM Alliance partner with your agencies to just start by measuring? When we talk about this single point of entry, where are we asking people, do you own a device? Do you have access to the internet? Do you need help with digital skills? So you can have remote patient monitoring, and so that you can go onto job portals and write your resume and so forth. How can we partner with you to start examining this through line?
Respond to that. So one of the, I don't know if it's a hidden secret or not, but the county receives community development block grant funds from HUD. So we receive about between $4.5 million to $5 million a year. And we support projects in municipalities that are part of the Urban County Consortium. Right now there are 31 municipalities, primarily one city, which is the city of Peekskill, and the rest are towns and villages. The nonprofits who are also providing services within those municipalities are also eligible to apply. And we fund programs that will support primarily low-income households, right? So if you would like to propose a program in a particular jurisdiction that is part of the Urban County Consortium, we will certainly look into it to see if we can provide some funds towards that particular proposal that you just mentioned. Our funding round opens up next year. It's a 3-year funding round, so I'm just giving everybody a heads up. But that is something that we can really look into and explore.
And I think you raise an important point. And I think one of the things we've tried to do in recognizing that in social services, when we allow now individuals to submit documentation remotely and upload that, we thought about that because who has scanners necessarily? And we created systems that could do that with our phones, because so many more people have phones, but even that can be a limitation, and certainly more challenging in bigger projects you talk about. So thanks for sharing that.
Yeah. So thank you for the correction. In most of my programs, we do have access. Not personally every one of them, but a lot of the programs have also found secondary funding, which will allow for devices to be given to the youth to use during their time with the programs, so that they can do research, they can take online classes. We're fully aware that if a class is online, it's useless if you're not online.
Right.
So a lot of the programs, all the programs have access to tablets or devices that the youth might not be able to keep after, but they could use it during their duration with the program. So that's what I'll say. We do have those things available, and it is a service that is AI can help. Search engine can, I'm sorry, not a search engine, an AI engine can help anybody who does have access, which makes it more equitable than nothing.
We'll do one more on this side, two more on this side of the room, and then we'll switch over. So, Brandon, if you can pass Emily the mic up front, and then Assemblymember Levenberg.
Thank you so much. For those who don't know me, I'm Emily Saltzman. I'm the Director of Operations for the county, which means I am the luckiest person in the room because I get to work with all of these fine people. So I really want to just say how proud I am today to have county government and all of the work that we're doing on behalf of children and families so beautifully represented by a range of people. And we have some other people in the room, maybe just Adam, if I could, just have the DSS team, Aviva, and anyone else here who works for a county department just stand. I'm so proud of the, thank you. Thank you, and I'm so proud of the workforce that we have. We know we have work to do, and I hope that today you will see just how much listening is going on. We may not always get it perfect, but I think there are very few here who would think, I don't have access to them. And so I would hope that we can continue to hear from you. I know how accessible everybody is, and our county executive is everywhere. There might be 5 of him. So I want to say that today is for us, I think, a great showing, but also, and we have our legislators who are extremely accessible as well and always sharing ideas with us, that it's the beginning of a conversation and that you all are constantly sharing with us, not just the data, but your insights into program development, program improvement, et cetera. So thank you, Adam.
Thank you, and thanks for your commitment to transparency and communication. Assemblymember Levenberg, and then we'll move to this side of the room, so the mic will be yours.
Well, thank you so much. I guess I'm going to somebody wants me to have it. I'm Dana Levenberg, Assemblymember representing right along the Hudson River, basically from Briarcliff up north, a little bit of inward a little bit to a third of Yorktown and up through Putnam County into Cold Spring. I just want to lift up a couple of things that people said, which I thought were really important. And sorry, I'm going to talk for too long. But I really wanted to thank Michael for mentioning the school connection. It's so critically important. When I was on the school board, I learned that for many of the hearings, first of all, nobody knows what to do. Parents don't really get informed about those hearings. And that was, sort of an automatic direction towards suspension. And one of the other things I learned was that if we didn't have a lawyer from the school in the room at the time, that the hearing officer could only offer suspension. They couldn't give anything else. We started sending our very expensive lawyers into the room, and that greatly reduced suspension rates in our schools. And I think that's just really important. Things that people don't know or think about, please pass it on to your school boards. If they're not doing that, they need to spend the money, and it really helps. The other thing I wanted to mention was just about AI, and Liz, I appreciated what you were saying as a tool, but also I was just curious if you're also mentioning to kids which, coding may not be a great direction right now because that's going to be replaced. Okay, yes. You didn't mention that. I just wanted to make sure that that's also like part of the conversation. Obviously having access to devices can also help with telehealth and access to mental health supports. Telehealth has become so big now and makes it easier for kids and gets rid of some of the stigma that maybe, and also makes it easier to access if you can't have transportation. And then I did think at some point that the CDBG funds also did have a carve out for digital access or something like that. I know that when I was a supervisor in Ossining, We were able to get some free Wi-Fi connections in our parks, which is great. We still need the device, whoever was saying that, we still need those devices, right? To get into hands. So, you know, again, if it's not for a particular municipality, I wonder if there's broader reach for STEM Alliance to try to figure something out.
Just to respond to that was part of the stimulus, the additional funds that we got through CDBG during COVID.
Right.
And that is what allowed us to do that.
Got it. And then finally, I know we heard about the ACA. I just wanted to lift up that I'm a very big supporter of the New York Health Act, which would be universal health care. I feel like it underscores everything that goes along here, and the reduction of costs and getting the insurance companies out of the mix would be so huge to all of this, because we need money to pay for the mental health supports. We need money to pay for, for just making maternal health, making sure that our kids are, our babies are healthy, and all of that could really help so I'm just gonna lift that up for any of you who have labor that you're involved with that's fighting against it. Really think about the umbrella effect and the broad effect that New York Health Act could have, and help me fight for it next session. Thank you.
Thank you, and thanks for your audition. And we'll have a few questions from this side and then move to break, and again, the room will be yours. Please go ahead.
Wonderful, thank you. Good morning, Darcy Miller with Greater Mental Health of New York. I've gotten to work very closely with some of the panelists, as I have a 36-year career in county government. Westchester was a benchmark for many of the projects we initiated in Orange County, and I thank you for that. Being here with all of you, I'm very proud to hear all the great work you're doing, and being a recipient of many of the grants that you provide that allow us to really help children and families in this country. There's two things that I want to mention, so many things we could talk about, right? But one of the things about housing, you said 350 families who are homeless, right? $300 a night, probably a low figure for how much it costs you to house them. That's how much?
Exactly, no.
Yeah. So anywhere from $110,000 to $120,000 a year. That's $12,000 a month they can be permanently housed. That money is state money. One of my great advocacies as a commissioner was to say, how do we get them to shift how we house and support people who are homeless in temporary housing and move that money into permanent housing. The counties only have the singles, where they have the flexibility with how they use their funding, not families. So that's the one thing I'm gonna say. The other thing is very concerning to me, screen time, screen addiction. We're talking about the tools and how helpful they are, and I agree. You want a strategic plan, AI builds the most beautiful strategic plan you can find. But our young people, I just was recently in a training, and you all offered a training recently on screen addiction. 40% of 2-year-olds have their own iPad. 27% of 3 and 4-year-olds have their own smartphone. It uses the glucose in your brain and impacts your dopamine. We all know what impacts dopamine. Heroin, opioids, right? Causing deaths. Just saying, our young people, we're priming their brains, and we have to be really conscious. I know you're doing great work around that. We want to be partners in that, and all of us should be educated and ambassadors on how we prevent future mental health and substance use issues for our young people by not exposing their brains to so much screen time. That's all.
You guys are making this very easy because they're not really questions.
They bring their own A's also, their own answers.
Which is awesome, because we wanted to hear from you. But Darcy, I do want to say, and this panel knows it all too well, that the continuum of care, the HUD-funded programs, the permanent housing is really under threat. And I think that's a federal policy that we can continue to advocate against, shifting that money away from permanent housing, but also do what we can locally to continue to not just provide the emergency housing, but focus on the transition to permanent housing, as difficult as it is. Thank you.
Hello, my name is Dolores Hogan. This is my partner in crime, Patrick Hogan, my husband. I want to thank you, Laura and Kathy and the Child Care Council, for always being there for the parents, the children, and the providers. You always taking care of us, great group of people. The things I would like to say, what I would like to say is to piggyback off what she said. We do need childcare. We do need the money back. We need that money. We need the list to be open. But all of you on that panel, everything you're saying need to be brought into childcare providers. We need that information because we have the children and the parents first before the school receives them. So anything that's going on, we see it first. And me and my husband was 24 hours providers. We see it. The children come to us before they come to their parents and say anything. So each and every one of you on that panel, food, home, children being in trouble, mental health problems. That's not only with the children, it's with the parents. It starts with the parents first. So I need each and every one of you to give me a card to take to my program so I can pass it out to other providers. And you need to start incorporating this information into the providers program, the home base and the centers, because we get the children first and we see the things first. Thank you.
Thank you.
I just want to add, thank you, Mr. and Mrs. Hogan, and to your point, absolutely. I mean, I know the advocacy that Laura, her team, and the county did to get additional funding at the state level. As soon as we can get a commitment to move that out and open up that list, we're prepared to do that. For those of you that haven't seen, they have a wonderful documentary about their 24-hour care. What's the name of that documentary?
Through the Night documentary.
Through the Night. And thank you for that important work you do, and thank you for being here today.
May I just add that we do not do 24-hour care any longer. The main reason is because of insurance. All right, insurance companies don't, they feel that it's a liability. We had one insurance company actually tell us that sexual acts happen overnight. I don't know where they got that from. So that's why they stopped, they canceled our insurance because we were doing 24 hours. So that's something that the county or state needs. And thankfully we have Marshall and Sterling Insurance that helps out a lot. We had an insurance company that canceled our homeowners insurance, even though we told them 15, 20 years while we had them that we had daycare. All of a sudden one day they said, oh, wait, you guys got a daycare. It was on the application 20 years ago. So we're canceling you. So those are things that the county and state need to think of also. And last thing, I don't want to take up too much time. Even though we know Westchester doesn't have universal child care right now as that's going on across the country, but when it does happen or come into play, family child care needs to be at the table. Because what they're doing, especially with the city, providers in Mount Vernon are getting tortured because a lot of, some of them have kids from the city that ACS is paying for, and now since the city is now taking free, or at least it's free for the parents because it's not free. So now those children are being taken away from a provider, especially along the Bronx line, and some of them are closing down. And as Laura was saying, they're in fear of losing their livelihood and possibly losing their house. So that's something that definitely family providers, whether it's our union, voice, Child Care Council, we definitely need to be at the table. Thank you.
Thank you for what you do and for being the voice. We'll take one more question from Bijan and then some closing remarks from one of our county legislators, and then we'll move on.
Good morning, everybody. Thank you to WCA for putting on this event. It's something that I look forward to every year, and so the fact that you're already talking about 2029 is great. I'm always learning something from the panelists. My name is Bijan Kimirgar. I'm with Equus Strategies. We help nonprofits and government agencies using data for a more equitable world. And the question that I have is really around the state's effort to build a state longitudinal data system. SLEDS is what it's called in short. And this is an incredible effort that's being done, but New York State is actually late to the party. A lot of states have already had this system, essentially connecting childcare data with educational data with workforce data. And the opportunity to connect it to justice system data, healthcare data, all of this is really a great opportunity for learning. It also raises a lot of privacy concerns. Let's take for a moment the privacy concerns are addressed. What are some of the ways that we should be thinking about this system? What are you hearing from the state, and how is this affecting your agencies? What are some of the opportunities that we might have by connecting the data from our different departments? Because we see the cross-collaboration, but now that we're going to be able to look long-term, what are some of the things that you're looking to be able to say or do with that long-term data?
I can just start from social service. I think your point, and one of the biggest challenges we continue to have is data that demonstrates how effective our programs are and the outcomes of those programs. Unfortunately, it feels like a luxury to fund that kind of evaluation, and so when there is data that ties that together to demonstrate what actual outcomes are, it helps us better target what's working, what's not, what do we have too much of, what do we not have enough of. And we do that informally in our cross-systems work, but data would even enhance that when you have systems and we could track someone longitudinally through the system.
I will say, one of the systems that we use at the Workforce Board is OSOS. And I can't tell you what that stands for with the state, but it is tremendously helpful because it's clunky and it's a lot, but we can track the youth that we serve through that system, and the adults as well, but I can only speak to the youth side, where it's, you could see if we did trainings, we did 20 trainings in electrical training, and we did 20 trainings that we do not do anymore in coding because there's no outcome for that, so we're aware, but you use the data to say these people got jobs, or they only got entry-level jobs, or they got an entry-level job at the graduation from our program, and then they had a promotion in 6 months. So when you look at it backwards, it's like, okay, we're gonna keep putting them in electrical training because the outcome is good. There's other data points that we use, like we know that coding is no longer what it, and I'm gonna use that because of the example you gave. It's not gonna get you what it used to get you. So we have that data, usually with partnerships with DOL and their data, but we can see what tracks, what helps. So I could see, I'm not exactly sure how you tie us all together, but I could see it being very helpful in guiding us backwards. When we see the success, go back and do that again. When you see, even a failure is a learning experience, like that didn't work, so don't do it again. But I think it could be really useful.
Thank you. Lynn was just gonna add some comments and back to Assemblywoman.
Thanks, Bijan, for giving me that great honor. It's a question that's been percolating in my head. So, many of you know I'm the Director of Data at WCA. I just spoke there a couple minutes ago. One concern I have, and a concern that I've heard articulated across the data space, is the safeguards for data that's already been submitted. So, I'm interested in finding out, what guardrails and safety protocols do you have for data that is already in your systems? And then, Liz, you were talking about going back. I'm also concerned about going forward, about having AI use predictive models to determine the fates of families and children when crucial decisions have to be made. We know that caseworkers, they are stressed, they probably need a lot more resources than that are available right now. And it is so tempting to just dump data into an AI model and say, make this decision for me. And so how is the county making sure that the human interaction and human decisions are prioritized when we seem to be, as a culture, moving towards another direction?
So I'm just gonna speak to the AI piece, and nobody should dump data into AI and then accept the answer it gets out of it. But again, it's a tool. So you can put data in, and that's one thing that could be a possibility. I always see it's like another person at the table. You came up with this idea, I came up with this idea, AI came up with that idea, and then you humanize it. You look at it, you take it as an option. So nobody should be just dumping it in and being like, AI told us to do this. Oh, that's no. That's kind of what I'm gonna say, but to use it as a tool, it might come up with something you don't. And you're like, oh, and then you, the human, incorporate that into your outcomes and your thinking on how you analyze data. So that's.
I just wanted to jump in and say, so in probation and in criminal court and family court, we do a number of assessments on youth. I think there's 3 or 4 that we have to do on every youth that come in. And I always say our officers know these cases better than these assessments. So we might do an assessment and it might say something, but that assessment didn't ask the question that we know. And so we have the option to override certain things and put different services in place, because it's the experience that we have, it's the personal interaction with the youth and families, and they may answer questions one way and we know that they're not being honest. So I think the human element and the experience is critical in the work that we do with the families, because if we just went based off of assessments, this just wouldn't work for the work that we do.
And Lynn, to be clear on data, certainly we operate under the protections of the New York State data systems, which are extremely tight. I mean, unfortunately, people are frustrated sometimes when they can't get access to it, but oftentimes that's because of security, to your point, to try and protect and preserve that. So we're never just extracting and dumping data anywhere. Certainly we then duplicate that even at the local level with our IT group.
I mean, I know for us, even our IT department, we're not allowed to put a lot of stuff in the cloud, because that's then becomes a potential security risk. And I know for the data we get through the health department, we have to sign like attestation. I mean, our staff are very nervous when the data we get, it is very specific. And so there's a number of people who are very limited access, even within our department, who people say, well, you got it, we're the same agency. No, you weren't on the list, you weren't signing the attestation, you don't have, even within, we don't always aren't always able to share.
Thank you all for your sensitivities to that hot topic. And before we close, just a couple of remarks from 2 of our county legislators, Williams Johnson and then Barr. Did you want to say some words to the room?
Thank you so much. Good morning, everyone. Good morning. I just wanted to relay something that's been on my chest. This is, first of all, thank you to Westchester Children's Association. Your critical advocacy and all the work that you do are so valuable, and our county and the children in our county are better because of you. Of course, this is my 4th time coming to this annual event every year. And I want to take a brief moment to recognize our county commissioners and departments who do the essential work of implementing and delivering programs that serve our children and families and communities every single day. I also want to respectfully clarify something important. A theme I'm hearing about Westchester County government. For those who don't know, the Board of Legislators is a co-equal branch of government. And one of our most critical responsibilities is the county budget. The programs we're discussing today are only possible, of course, not as fully funded as any of us would love, but they are funded not only because of the county executive, his administration, and our dedicated departments, but because they are reviewed, shaped, funded, and ultimately adopted through the legislative budget process. That is a responsibility we, legislators, take very seriously, especially in times like these, when every dollar must reflect our values, our priorities, and the needs of real people. We're proud to partner with the administration and our commissioners, but I also want to uplift the weight of the board's role in ensuring these programs are funded, sustained, and accountable to the residents we serve. So I really thank the commissioners for executing this work with sincere care, and I thank my colleagues on the Board of Legislators for continuing to approach the budget with the seriousness, the compassion, and the purpose our communities deserve, keeping in mind our fiduciary duty to our taxpayers. It's a challenge, not only in the fall during budget season, but we carry that weight throughout the entire year. Thank you for allowing me to relay this. Thank you to the Westchester Children's Association, again to our departments, and to every organization represented here in the room today and those that are not, for continuing to show up, to stretch limited resources and serve as a lifeline for our most vulnerable residents. Your work reminds us that compassion, it's not passive. It's active, it's demanding, and it's one of the strongest measures of who we are as a county. Thank you.
Thank you. I promise to only take 2 minutes. First of all, again, thank you. I'm going to make it that part quick. Thank you, obviously, to the Children's Association and to all of our Westchester commissioners and staff and everybody here who was here. I just want to point out, Legislator Jill Williams-Johnson is our chair of the Health Committee. I chair the Social Services, Disability and Human Rights Committee. We are always interested in hearing about what the challenges are and suggestions for how things can be better. We hold committee meetings. We'd love to have you come and and speak about some of your issues. And of course, we always welcome everyone from our great partners in the various departments. And I've taken some notes I will follow through on some of those things. I won't talk about that because that'll take more time. But I do want to just say something about the collecting data piece. We have, I know it's not a big surprise to anybody at this point, but we have a federal government that is looking to weaponize that information. And they are, the layest thing, I'm sure you've seen, they're threatening not to have the post office deliver ballots if that particular jurisdiction hasn't turned over their voting rolls. Seriously, beyond. So the point is, if we have that data and we have bad actors trying to get control of it and holding it over our heads, we have to be so careful about the data we collect and how we keep it. And I absolutely agree there's lots of value in gathering that data, but if we can't protect it from bad actors, then we can't collect it. I think that's the bottom line. But thank you so much, everybody. Very happy to be here and learn so much.
Thank you for that clear call to action. Appreciation for co-equal branches of government.
Adam, can I just add?
Yes, please.
Because I want to be clear with the legislators.
Yes.
As they know, and I thank you, Legislator Joe Williams-Johnson, because we know that you guys ask some of the most important, toughest questions of us when we come before you. But then when you, as you said, have that role in also approving our budget, you also are our biggest cheerleaders. So I just want to say that your remarks are spot on, and we appreciate that partnership. So,
as was I. Thank you for that real-time demonstration of co-equal branches of government partnership. I'll use the words checks and balances. Here's to a healthy democracy in Westchester County and beyond. So thank you for all of that. Big thanks to everyone who spent some of your out there humid Thursday morning here, cool, calm, and collected, for being together. Let's commit to staying together through this end of spring, through the summer. Looking ahead to the fall, Westchester Children's Association will be proud to host our annual advocacy breakfast. It will be on October